This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to the best show on the radio. Good morning. It's another edition of Health Watch every Sunday, 8 till 9. It's that time right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We will discuss today with you the who, what, when, where, why, and how of Innovative Medical Associates, how it can potentially help you and your family improve your overall quality of life. And we will take your calls, if you so desire, at 855-839-1210, 855-839-1210. That's the number here in the studio. At any time during the course of the show, feel free to call in with a question or a medical challenge you want to run by Dr. Molly Fantasia. And with that, we say good morning to Dr. Molly.
Hi, John. How are you today?
We're good.
We're up and around.
And it's a beautiful day.
It sure is. And we're doing this show from the beautiful Bella, so how could anything go wrong?
That's right. I mean, and it's a good day to get healthy.
Amen.
Okay. Well, we always start with the question, what is it you do and how is it different from other facilities like yours?
Yeah, John, I'm glad you start with that question because inevitably all week long when people call the office, they're still not sure what we do after how many years on the radio?
Yeah, we've been about 20.
Yeah, isn't that unbelievable?
Yeah.
But it is true. It's a little difficult concept. What we have are like-minded healthcare providers who all work out of my facility, a licensed primary care facility here. And what we do, though, is we can do anything that any other primary care facility can do. We can order a prescription. We can send you out for specialized testing, a radiology. We actually have an ability to run the blood work right out of our clinic. So, again, we're like any other facility that does primary care. But what makes us different, John, is the fact that our philosophy is we want to use the least amount of pharmaceutical to help you correct your medical challenge and maintain a quality of life. Quality of life is what we talk about no matter what the condition is, no matter what brings you to our facility. We're about making you enjoy your quality of life. And, that's no easy task.
No, it isn't.
Because everybody's quality of life seems to be a little different. Some of my people there, and I like to call my patients my friends after all this time, they want to play golf. Other ones just want to play with the grandkids. Some other people just want to relax at their beach home. So, again, quality of life. And then I have some that want to work until they're 95, and we like to make sure that happens.
That's you and me in that category,
That's true.
Right?
That's true, because our work is our life.
Yes.
So, in that case, these are the things we want to accomplish. But how do we accomplish this? We accomplish this by utilizing natural substances, vitamins, minerals, amino acids. These are the kinds of things you can buy in the health food store. But we also have a unique delivery system. We use hydration as the vehicle to deliver this because why? It's a better delivery system. It can be more accurate, more precise. And by the way, lately, it's even better because of the hydration that it delivers, in addition, the way the weather has been. But it can solve our problem. Most people have a problem with natural substances. They go into the health food store. They don't know what they're getting. They depend on the clerk. And what happens? You don't take the right combination or the therapeutic level of something to effectuate the change.
And you really can't get a therapeutic level in a pill.
No,
correct?
The most direct hit to where we want it to go is through the IV,
yeah.
right, through the hydration. And that in and of itself makes the difference in what we do.
I think people want to know, and I want to know, how does the nutraceuticals, how do they work? Why are they working as opposed to maybe a pharmaceutical may not?
Well, I'm not saying that the pharmaceutical doesn't work. I'm saying that the side effects with the pharmaceuticals may be more than what you would have with the natural product, right? But because you don't get to a therapeutic level, or you're not using the right let's say, synergies of these particular nutraceuticals. And the only way, in my opinion, to get really to the therapeutic level is through the IVs. It's the quickest way. And so people then can effectuate the change maybe in as little as 5 weeks. And that's quicker than sometimes taking the medication.
And that's the fascinating part of your facility, is that sometimes people come in and they say, gee, I feel good after a couple of treatments.
I know that.
And that's happened a lot.
Oh, it has happened a lot. It depends on what you're coming to. Look, the earlier you get in, the better you're going to feel. I mean, let's not kid around. The more complex your case, the more work we have to do from this perspective of putting together the actual protocol for a patient. But again, what we try to do is never tell a patient, throw away your pharmaceuticals. We're not going to do that. That's crazy, because you could have rebounds, you can have all kinds of problems. So what we try to do is help a patient, and I have great physicians, as you know, and great medical providers. You know, I got great nurses, right? My nurse Don is fabulous. My techs are great. We know this process, and so we're going to be able to help you cut down on your pharmaceutical and bring in the nutraceutical in a level that works and doesn't put you in harm's way.
How do you explain to people when they're, especially the initial consultation, what you do, and then, you know, how do they take it from there to maybe signing up for your
what I will
treatments?
say is, look, lots of times, unfortunately, I see people who come to us in desperation. And that, of course, is a much more difficult task, because they've exhausted maybe all their conventional treatment, whether it's cancer, whether it's autoimmune, and they're taking the biologics and they're having all kinds of side effects, or they're not sure they're having side effects to the meds, or are they having side effects to their condition. So this is a process. You didn't get this way yesterday. You're not going to get relief today. I mean, you have to realize this is a process. And the other part of this process is we have to understand what it is you want to accomplish. You know, people come in and they start to feel good, right? And then they say, well, you know, Dr. Molly, I have this other little problem. I said, well, really? Okay, tell me about it. Blah, blah. But I said, you came in with this was your major complaint, and we've helped you lick your fatigue. That's just, I'm using an example.
Yes.
Right? And now we know, oh, you have joint pain too. Okay, well, I can help you with that. The idea is I have to get a good first appointment with the patient and get in that 15 or 20 minutes exactly what they want to accomplish, what they're feeling, and how is it the history of how they got to this point.
The question you always get,
Yep.
Does this work?
John,
and how could you tell
well,
a potential
first of
patient?
all, you know, I can tell with the quantitative data. I can look at blood work and see certain analytes are improving. But that's one end. You know, I have an instrument, the body K. That gives me an indication of what kind of shape you're in specifically, and maybe any hidden kind of things that are going on that you're unaware of potentially could cause a problem. So, yeah, I have data. But you know what really works, John? People come in and start talking to other patients, right?
I know that. I witnessed that.
I know. And here's the dilemma, or as I see the goodness of what we do. People are anxious to help other patients. Patients are anxious to help other patients. And what they do is they tell you, hang in there. Maybe I didn't get relief in the first 3 treatments, but by 10, I was like a new person. And so therein lies the rub. I don't know. For the most part, people get relief from their symptoms or their conditions or their syndromes in the first 5 treatments. But I don't know if that always works. It depends on, if you come into me with 4-stage cancer and you're falling on the ground and your fatigue is out of this world, it might take 10 treatments for me to get that fatigue under control.
Yeah, but there's, and I mean, it attests to the fact that you're always busy. I mean, your place is busy.
True,
I mean,
because we're medical hydration.
Right.
We're not a spa. We truly want to know and understand what's going on for you, the patient.
So somebody is being successful with your treatments.
Right.
A lot of people.
A lot of people are being successful with our treatments. The question is the time frame. And again, look, as I say to people, I don't want to go steady with you. I want to, but also I can't do this too quickly either because there's a lot of physiology and biochemistry in what we do. Look, we're not a spa, John. It isn't that I don't want you to look beautiful, because I do. I have a skincare line. Come on,
Yeah.
put your sunscreen on.
That's right.
But the point is, my focus is on you, the patient, and what it is that I have to do to make your condition and eliminate some side effects from your condition and or the drugs you're on.
We are coming up on our first break of the morning. The show is Health Watch, and it is here every Sunday from 8 till 9, the live version on Talk Radio 1210 WPHT. The number here in the studio, 855-839-1210. That's 855-839-1210. And we always tell you at this point in the show, call early so you can be sure that we get your call in, because it happens every week. We get a couple of calls at 5 minutes to 9. So not a lot we can tell you in that particular time frame. So call early, 855-839-1210. And Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And again, I'm your host, John DeMasi. We're coming back. Both of us return after these words.
Hey, Clementon. We know your favorite station is Talk Radio 1210 WPHD.
Back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates, and the number 856-489-0505. When you call, all you want to do, real simple, set up the initial consultation with Dr. Molly. It is complimentary, and you can find out a lot about what they do at Innovative Medical and how it can relate to your condition, and you'll really get informed, and that's going to help you make a more effective and intelligent decision. 856-489-0505 is the number, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. Our program is Health Watch every Sunday, 8 till 9 here at Talk Radio 1210 WPHT. Number here in the studio, you want to call, talk to Dr. Molly right now, 855-839-1210, 855-839-1210. Before we get into what we're going to talk about, I just wanted to mention how people say, how do you know this thing works, or how do you know your treatments work?
Right.
So this discussion happened the other day when I was getting my treatment,
right.
and someone said, you have people coming from where? And somebody said, oh, they come from Indiana, Ohio.
Right.
They come from all over.
California.
And this patient was surprised, but it goes to show you that they come from all over.
They do. They do.
And the question was, why do they come here? Because nobody does what you do.
Well, I appreciate that, John. I think the bottom line is this. I get a lot of referrals from other healthcare providers. It's all in the down low. It's all in the down low. It's like you get a network of people. You know, I have a good friend in I guess, Oregon, and I've had her on, Dr. Carr on. But from other healthcare providers, including physicians, and a lot of registered nurses make the referral because they're at the front lines of most of these conditions, and they see that a patient maybe is stuck right at a plateau and what's going on. And I get a lot of calls. I actually get calls from the nurses in various spots who send people to me. So it's very interesting, and I appreciate, you know how I appreciate the nurses. I appreciate all the healthcare providers.
All right, 855-839-1210. That's our number here in the studio. We are going to talk about now another initial.
Okay.
And it's not the department store that we used to go to.
No.
CIRS, CIRS.
Right.
And what is this?
Okay. This is an interesting thing. It's called chronic inflammation response syndrome. And you guys remember POTS from last week. It's
Yes.
sort of, I'm on a roll with all of these syndromes, right? Because they're so difficult to diagnose and separate. So in this case, what this is it can be a very difficult condition to diagnose because it has many symptoms, okay? It's usually caused by an exposure to something. It could be an exposure to a tick bite. It could be an exposure to a wet building. You know, you've heard me before talk about water damaged buildings. It could be even things like poisoning, food poisoning, or contaminated water. Actually, an interesting thing happened to me that got me thinking about this, John, last week. I had a young man who was doing some type of missionary work in another country, and he came into our office because his grandmom pushed him to come in, and I was glad he did because he had particular blood counts on his liver enzymes that were in the 4,000.
Wow.
Okay, and as a result, I quickly told him he's got to go to the hospital and see an infectious disease guy. But now he's suffering from this syndrome because the syndrome may start after the initial exposure. So some of the things that occur are diarrhea, nausea, congested sinuses. You may have an impaired memory and cognitive problems. That's an interesting thing. Heightened skin sensitivity, skin breakouts. I have a really good guy who comes up from Ocean City. I know he has a particular situation developed from this chronic inflammatory response syndrome. Vision, blurry vision can come. Weaknesses, body aches. So there's trouble concentrating. There's thirst. There's just joint pain. So what happens is you can go down the rabbit hole on each of these symptoms and miss the bigger picture, that it actually is the entire history is what you need to get to. First, you start with a good history. I want to know, like that young man who came in, I said to him, well, where in the heck have you been? He's 24 years old. He just graduated college. And he said, oh, I was on a missionary thing in some African country. I said, oh, and what did you do there? Well, did you drink the water? Did you eat the food? Well, yeah. Okay. So now I had an idea that he actually brought this toxin into himself, which started him. So am I sure they have to treat the initial problem? We have to stabilize him, get those liver enzymes down by detoxing him traditionally, right? He's back in my chair, though, after a week. All right, he's back in my chair weekly now, actually twice a week, for us to continue the detox for him. So here's the thing. Something starts it, and now you have all of these issues. How do I find out about it? First, history. I need to know. I ask the questions. Secondly, not just the history, but I need to know, what are we focusing on? What is the issue? And of course, I'm going to run traditional blood work. But when I get a history like what this young man had, I have to start doing things related to this syndrome. And the key to that is I've got to do some special biomarker testing. And believe me, you could have a genetic issue that makes it difficult for you to detox these particular substances, whatever they are, whether they're bacteria, viral, or actually mold or some other type of challenge.
It seems to me that if you have some of these symptoms,
right,
how do you know?
You don't. No, you don't.
And so here you are, probably going through these maze of tests. How long does it take you?
Listen, this will not show up on mainstream testing. You've heard me say this. You can get the particular specialized analytes done with the labs I have in my organization, that the labs, the traditional labs. You might need a couple specialized in addition to that stuff that they don't do and they'd have to send out. But you've really got to look at these particular analytes, because to find this, the biomarker has to be measurable so that it can show me where we got to go in the long run. So initially, you can treat the patient with a combination of high antioxidants, etc. But I want to get more specific for a specific problem.
Your hydration treatment for something like this, when you decide, when you find out what it is, how is that a longer treatment?
Well, I think that would be a treatment of 30, definitely 30 treatments. There's no question. Not only do we have to remove the particular let's say the particular cause of the challenge, once we know it, whether it's bacterial, virus, or something from the mold, that kind of thing, sick Bildring syndrome, something. Because, here's the other thing, John. As simple as inhalation. We can be somewhere and inhale some toxic fumes that don't even know it. And maybe if you're in great shape, you actually get them out of your system. The liver does its job. The respiration does its job. But if you have a little genetic dysregulation, you may end up with one of these syndromes.
It seems to me that hydration is perfect for this.
It is. It is. It absolutely is. And actually, why? Because it can deliver the specialized type let's say, nutraceuticals, as well as subclinical doses of particular, let's say, pharmaceuticals to help a patient come back to a good quality of life. Because something like this absolutely, unequivocally makes your life miserable. You don't die necessarily from a syndrome, but you sure can wish you were dead.
And really, and when they come to your facility in a situation like that, they're desperate.
Right, and that's exactly right. So what do I have to do? I got to find out what is the initial cause of this and try to remove the exposure. So obviously, if it's mold, et cetera, or environmental, you want to pull that stuff out of their home. And so you help them get to somebody who can do that kind of thing, right? You need to have the mold remediated, and down at the shore there's a lot of that. We might have to remove carpet. That's an interesting thing. In fact, I think you and I spoke about that once in one of your offices.
Yes.
You have to remove the carpet because the carpet fibers could be a catalyst to doing this syndrome. It may be the paint, not just the lead lead. It may be something else, but something does this. And then again, if you drank water that was contaminated, we got to remove the bacteria. So these are the things you've got to start to look at. What's initially causing this, and if all else fails, you've really got to start honing in on the symptomatology. But you must run these specialized testing because this condition, these damaged biotoxin issues that really regulate cellular function, don't show up in traditional testing. It may not. Lucky for this young man, his liver enzymes were so high. He was young. His liver was working overtime to get rid of the toxin, which is why it was so high. But some people come in and their liver enzymes are perfect, and they're still suffering from a lot of these symptoms. So, you've got to look at this and really say, okay, you must run these specialized tests because we've got to see where this is coming from.
Talk about finding a needle in a haystack.
Yep, this is one of them. It's like POTS in that.
That's
That's
right.
why so many syndromes. It's amazing.
We are coming up on the halfway point of the show. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. Our number here in the studio, 855-839-1210. That's 855-839-1210. You have a question for Dr. Molly or a medical challenge you want to run by her, feel free to call us up, 855-839-1210. It's Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT. I'm your host, John DeMasi. Dr. Molly and I return with more of Health Watch after these words. Back here on Health Watch, and again, operators standing by at Innovative Medical Associates, and the number 856-489-0505, 856-489-0505. And when you call, very simple. You make that appointment, schedule the initial consultation with Dr. Molly, go over your situation and your problem, and from there, the sky's the limit. 856-489-0505. That's the number. And the website. A lot of good information on that as well. You may want to check that out. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com. It is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Our number here in the studio, 855-839-1210. 855-839-1210. We're continuing our discussion on CIRS.
Yes.
And I wanted to ask you,
Sure.
how many, and this, you said it was a hard situation to diagnose.
Yes.
How many blood tests would you maybe have to potentially give until you figure it out?
I think you take that in the very initial consult, not the free consultation, but when they come back to be a patient. There are some very specific tests that we would do, something called VIP, which is a peptide test. I might want to do TGF, which is a beta 1. There are very specific tests, so I have these down. Generally, it'd be about maybe 7 specific specialized tests along with conventional, because I got to make sure their kidney functions are good, etc., just to do the IV therapies that we're doing. And I'd want to look at the liver enzymes, of course, immediately, like I did for this young man. But these specialized tests really give me a handle on making sure that I'm trying to get the particular biotoxin, if you want to call that, or the agent that is causing this out. That's what we're looking to do. Now, the IV therapies are key to that, but in addition, John, see, in normally these patients, these CIRS patients, for the fact of the liver secretes bile during digestion, right? The bile then contains some of this particular toxin, right? And so what happens is that it can recycle back into the body. So obviously I've got to do something in the GI tract as well. And that's where we use some old-time medications that have been FDA approved that were very hard. By the way, when we ordered this one particular medication that comes in a powder, John, the pharmacist called and said, that hasn't been ordered since 1957. And I said, sure it has. And then he laughed. He said, and my compounding pharmacist knew exactly what we were doing. We were doing a binder to help the patient excrete out the extra toxins out, okay, after the liver functions. So there's an art to this, John. It's not just bang, you throw the IV on. But what do you think is one of the major constituents of the IV? Come on, it's your favorite.
Vitamin C.
You got it. Why? Because it's one of the largest chelators out there. It is a chelator as well as an antioxidant. Some of the other things we might use is turmeric, alpha-lipoic acid, ginger, grapeseed extract, vitamin D, very important for immunity. You know that. Curcumin. And here's one for you. We would use EGCG. What is that? Green tea extract. These things would be in the IVs, okay? And so that goes hand in hand with whatever else subclinically. I might put them on a subclinical dose of another pharmaceutical. But again, we're looking at things that we know are more natural in this process than more drugs.
We have Frank in the Northeast.
Hi, Frank.
We haven't heard from him in a while. Good morning,
He's
Frank.
He's a busy guy.
You're
Frank,
on Health
you're the
Watch
busy
with Dr.
guy.
Molly.
How are you?
Yeah, I'm busy.
Yeah, how are you?
I heard you say vitamin C. I have a quick funny story about that.
Sure.
Back in high school, I was at my dad and one of his friends on his friend's boat. You know how boats have their names on the back?
Sure.
It was vitamin C, but S-E-A, vitamin C.
Yeah. That's great.
Right.
I actually, you know what, Frank, I'm glad you mentioned it. I actually have a T-shirt with that on it.
Really?
Yeah, thank you. Great minds. Yours and mine. Great minds think alike, my friend.
That's right.
Don't get carried away. I'm nowhere near you.
Oh, come on, stop. But these chronic syndromes, Frank, like you have an autoimmune, but in essence, it's a chronic syndrome. Yes, of course. That's the other thing I was talking about. People can have a particular genetic propensity for these types of syndromes, and unfortunately, they are difficult. They are very difficult. So, God bless you, Frank, for continuing to, seek out solution.
And Dr. Molly, I called in because you mentioned about liver enzymes.
Yes.
A couple of years ago, my family doctor was doing the yearly blood work.
Mm-hmm.
My liver enzymes were elevated.
How elevated?
I don't remember, but I was like, I wasn't paying attention. She didn't tell me at first. She kept ordering more blood work.
Right.
I kept asking her, what's going on? She goes, your enzymes are elevated. I said, which ones? I said, well, I'm not drinking. I haven't drank for years. No,
Right.
It's not that. And she was ordering every test she could imagine to find out what's causing it, and she couldn't figure it out.
Right.
But there was one of my liver enzymes was elevated, and she had no idea what caused it.
Right. But see, because then you really got to go into the specialized thing, and then you also have to get a good history. Were you exposed to something? Did you have a tick bite? I mean, all the things I talked about earlier in the show. I mean, anything can trigger these types of syndromes. And the question is, which one do you ultimately suffer from, or is it just an overall CIRS type of situation? And it can be. So, Frank, you are a very, very interesting case. You know that, and you're not easy. God bless all the doctors who treat you. I mean it.
Well, no. They don't treat me. You treated me, and my chiropractor treats me. He does muscle testing.
Thank you.
Seriously, they come in and get the usual 10, 13-minute visit if you're lucky. You know what I'm saying? That's pretty
Yeah,
much
I
it.
know. And
But
there's no way you can do this with a 10-minute visit. No way.
Let me just add something John said earlier, that the best program on the radio. That's true. But I want to add to it. It's the best thing, period. Radio, TV, news, magazines, newspaper, whatever. Where else can you go and someone listens to you? And that 30-minute consult, that free consult in the beginning, baloney. I'm saying bring your lunch, bring your dinner and snack, maybe even tomorrow's breakfast. And she'll talk to you. She'll ask you questions no other doctor asks you. And you, mean the patient, thought about it, but the doctors don't ask you because Dr. Molly knows what she's doing. That's why people coast to coast come to see her. She's awesome. Anyway, have a great one.
Thank you, Frank.
Well, thank you, Frank. Thanks for the commercial,
you humble
too.
Me, honestly. You
Thanks for the
humble
call.
me, my friend. God bless you. God bless you. That is a great call.
Yeah, it was.
He's a nice guy.
855-839-1210. That's our number here in the studio. We were talking about CIRS and
Yes.
the syndrome, and there's a lot with this thing.
So, John, this is not the kind of thing you can walk in. We come up with what we got to do because, again, we have to address everything: the fatigue, the body aches, the weakness, possibly light sensitivity, the increase in certain normal, if you want to call them normal, blood work. How about the skin sensitivities? I have a patient coming up this week from Ohio. He texted me. He's an older patient of mine. He's been here before. He texted me and he showed me the skin outbreak he's having. I am sure that something triggered that, and he's suffering exactly from this condition.
Boy, I tell you, you get some complicated situations.
I do. I do.
Really?
I do.
I mean, no wonder your wheels are always turning.
Well, you know what else? You really got to sit and listen to the patient. Like this particular patient pours concrete. So I'm wondering if something where he was either bit him or maybe he was exposed to something in the pour. I don't know.
Yeah.
And I'll know a little more when I do those specialized testing that we were talking about. Because what they do is they help me see if something goes down in those markers or goes up in those markers during a treatment, I can equate that to a particular type of thing, whether it's mold, etc. So there's the thing. And God bless my medical director.
We are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge for Dr. Molly. 855-839-1210. That's the number here in the studio, 855-839-1210. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Dr. Molly and I return with more Health Watch after these words. We are back here on Health Watch. Operators standing by at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock. What do you think? They're going to the beach? No, they're going to be answering your calls. 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, if you miss any of today's show or if you heard it and you want to hear it again, we have our Health Watch replay this afternoon, 4 till 5, right here on Talk Radio 1210 WPHT. Our number here in the studio, and we still have plenty of show left, so you can call in with a question or a medical challenge for Dr. Molly, 855-839-1210. That's our number here in the studio, 855-839-1210. We usually, at this point in the show, we kind of go over some patients and we want you to know how they're doing and show the progress and so on and so forth. And we have a couple of patients. We're going to talk about Jessica.
Yeah, Jessica is a very lovely woman. She's a young woman. She has breast cancer. She's been with me approximately 2 years. She had done all the traditional treatment. Her husband is a registered nurse, and he's a great guy. They have a wonderful family. And, of course, she wants to be around for a long time. Unfortunately, she did have a lumpectomy, I guess about 3 years ago. Started with, he does actually consults with another integrative physician, which I find very interesting. I try to work with them, and we do. And she, of course, is doing our anti-cancer or cancer supportive therapies. The interesting thing is, of course, the lumpectomy, and the surgeon had advised her against a lumpectomy, but rather a hysterectomy. a mastectomy. And also said because she had a genetic propensity for this and the tumor came back with those particular gene sequences, she chose not to do it at the time. Again, her kid was only in kindergarten, so I could understand why. But unfortunately, it came back about 3 months ago, and she found another lump on the other breast. So at that point, she was faced with a decision. You know, my vote was, you know me, if there's a chance to get it out, get it out. If you have a chance for surgery, folks, and they can remove a tumor, get it out. Get, as I like to say, take out the culprit, right? You know, cancer's a beast. Period.
Yes, yeah,
Cancer's
right.
a beast. So the good news is because she was so tuned up and she was doing well, meaning tuned up physically and not in a bad place physically, she and her husband decided to do the double mastectomy, get the thing out, you know, be done with it, and she's back in my chair. So she was off for like a week from treatment. She was back in this week. We went over the game plan for her, which we'll continue to use, vitamin C, some of the homeopathics, and her integrative physicians suggested that I do a few more, some other things that we have available to us, and we're going to do it for her. But what is interesting about her case is the surgery took out 12 lymph nodes, John. 12.
Wow.
But guess what? None of them had any cancer cells.
And that's attributed
that,
to...
I believe, is
right.
attributed to her doing everything right with her diet, obviously, reducing her amount of sugar and sweets and gluten, all of those things, keeping her protein up and coming to us. I believe that the cancer supportive therapy was involved in that. And actually, her integrative doctor told me she absolutely believes that that's correct.
And you have several other patients that we're going to talk
Sure.
about. A patient with GI problems?
Yeah, the young lady that I did who was 16 years old, and she came to me from Ohio. Her mom and dad took her in. Very, very severe Crohn's disease. She really was pretty bad off when she came back. She came to me about 6 or 7 months ago, but they didn't stay long enough because there were some family problems or something. But this time she did. She spent a full 10 days with us. We were able to bring up her protein markers, increase her white blood cell counts. This was done with our particular hydration, focusing in on these kinds of things, the iron, both orally as well as infused iron. And I use a very specific type of iron. And you know that I got an iron supplement that does not upset your stomach. You know that, and it's from Italy, a pharmaceutical company in Italy. But here's my point. My point is using a combination of things, including subclinical doses of a traditional drug that isn't used for the GI issue, but used in other areas, is working for her. We managed to stabilize her. She's doing well. She's ready to go back to school at the end of August. And I think that is a win for us. I mean, we haven't cured the Crohn's, obviously. Another patient with GI problems. His was a little different. He had something called Crohn's, but it really was a result of C. diff. Have you heard about C. diff?
No, this is another one.
Well, right, but C. diff is an acquired infection that you can get from being hospitalized and scoped and all of those things. So in his case, he was really faced with a bad decision because they wanted to put him on a biologic, which has a lot of side effects. He's a young man. He's only 40-some years old. This could really be detrimental to his quality of life. He runs his own business. He really can't afford to be down for the count. And as it was, he was in a state of terrible inflammation. He said he had 4 or 5 bowel movements a day, this kind of thing. So he was dehydrated when he came to me. He's now on his 2nd week or 3rd week of treatment with us. And we actually did a procedure that used a natural product as an implant, which I can't go into at this place, but it is actually a implant that is available. But it's used for people it's natural in substance, and you can get it from a pharmaceutical company. It's pretty expensive, but we augmented this with what we do, and I'll tell you what, he called this weekend and told me how well he's doing.
I'm listening to all these cases.
Yes. Yeah.
And I'm thinking, you must spend so much time researching.
I do.
And developing these nutraceuticals.
Let me tell you something, John. Everybody who comes to me and they've done traditional cancer care, which I believe in. We have great cancer hospitals, that. But they come in and they say, well, the tumor board met. Well, let me explain something. The nutrition board meets at my place at least 3 times a week. I'm discussing it with my nurses. I'm discussing it with my medical directors. Depending on the patient, I do the research. I come in with it. I look at it. We talk about the case. And that is what we do. That is what we do. And that's why we are not a spa, John. I love vitamin C for all of the good things it can do for our looks, etc. But it is the work that we put into people from their conditions that I believe really makes a difference about what we do.
And you've always said, and you've been pretty adamant about, you are not a spa.
Absolutely.
You are a medical facility.
Right. And as a result, we're able to really put the time in for the patients and put the time in to really look. See, lots of this, John, is done behind the scenes. I mean, we don't bring our patient in every time we discuss the case. We're actually discussing the case on an ongoing basis, right? Now, I come out on the floor, as you know, and we discuss their situation in the moment, or I'll bring them in with Dr. Pat, and we sit down and talk. But the bottom line is this has to be done because the changes must be made to protocol.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now, and they will be there well after we leave you at 9 o'clock. 856-489-0505. That's the number, 856-489-0505. The website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, we have our Health Watch replay today's show this afternoon from 4 until 5. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Lana, Donna, Jess, Jim, Daniel, and of course there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll do it all over again next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPH.D. Take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.